Hi, my name is Dr. Devi Shetty. I am speaking from Narayana Health City in Bangalore. I would like to take this opportunity to congratulate our Honorable Prime Minister, Mr. Narendra Modi, for completing 20 successful years as a leader of the state and leader of the country, and more than that, as a perfect statesman. Congratulations. I had the privilege of meeting Mr. Modi many years ago when he was the Chief Minister of Gujarat. He took time to visit our health city in Bangalore and expressed his desire that similar hospitals should be built in Gujarat. And as usual, I nodded my head and I said, it's my privilege to build. Knowing well that many chief ministers visited our hospital, they offered us all the assistance, but generally not much moves after that. But Mr. Modi was an exception. Within 6 weeks, I had a call from his office that 4 parcels of land is ready for me to choose and they're waiting for my visit. And I just couldn't believe it, but I thought, let me take a chance. And I visited Ahmedabad, looked at all the 4 parcels and took what I thought was the best plot, a large plot of land in Ahmedabad. And in 2 months, land was handed over to us. In about 18 months, the hospital was ready, and sure enough, Mr. Modi inaugurated our hospital himself. It was a great, very unique experience for me as a doctor trying to build hospitals and trying to reach as many people as possible to work with a leader like him. Coming back to COVID turned our world upside down. No one had an idea the impact of COVID, how it is going to be treated, what is the outcome, what is the modality of treatment. We had no idea. When COVID struck India, Mr. Modi declared early lockdown. There were a lot of questions. When we have only few thousand patients, why go for a lockdown? But retrospectively, that is the best decision he took. As I said, we had no idea how to deal with the disease, but we knew that thousands of people can die. So, lockdown period gave us enough time for medical community to understand from other countries how the doctors in those countries treated COVID patients and what is the infrastructure required. Only during that time we realized that steroid is the mainstay of the treatment. Till that time, for any infection, steroid was not given. It was contraindicated. All this knowledge we got by watching other countries struggle. And that happened because of the long, extended lockdown. We had no PPEs in the country. There was no N95 mask. In fact, it was pathetic to watch young doctors covering themselves with the motorcycle helmet, covering themselves with the raincoat, and going to COVID ICU. But in less than 2 months, everything changed. Country had hardly 30,000 ventilators, and we were expecting few lakh COVID patients in the ICU. In less than 2 months' time, everything changed. We not only produced enough PPEs for ourselves, we could become net exporter of PPEs. We could become net exporter of ventilators. Everything changed. All this happened because of the early decisions taken by the government under the leadership of Modi, so that I, as a doctor, As a senior doctor, after watching every country in the world, how they managed COVID, I have no doubt when it is a matter of looking at the number of the country and the number of people died due to COVID, we have done the best. I have no doubt about it. I'm extremely grateful to the leadership of the country for taking major decisions in the policies of healthcare delivery. I'll give you one example. Telemedicine was practiced in this country 18 years ago when there was no internet, when there was no cloud. India is one of the few countries in the world which has the privilege of having the capability to put the satellite on the space. Since ISRO's headquarters was in Bangalore, they were kind enough to give us satellite antennae, and they linked us with the huge number of public hospitals. Before internet became a reality, before cloud became a reality, I treated 53,000 heart patients in remote locations of the country with the satellite connection provided by ISRO. But then, telemedicine was illegal. Medical Council did not allow online consultation until COVID came. When COVID struck India, the regulation on online consultation, telemedicine changed, and telemedicine became legalized. These are the proactive steps which was precipitated by the COVID, but the decision was taken by the government, for which I am extremely grateful. When COVID was peaking, every country was racing to make their own vaccine. In the end, only 4 or 5 countries succeeded in making vaccine, and we happened to be one of them. We not only made vaccine, we managed to vaccinate virtually every deserving adult population of the country in a record period of time. I worked in different parts of the world. I know how the health system works. No country in the world could have vaccinated 150 crore people in such a short period of time. It's simply not possible. But we have done it. So essentially, India has managed to prove that we can do amazing things provided we have a leader like Mr. Modi. As a member of the various committees in advising the government about how to go forward with COVID management, as a member of the committee appointed by the Supreme Court, I had a ringside view of what the government was doing, what policies they were initiating in preventing the spread of COVID. And I learnt very, very interesting lessons. And these are my observations.